Today, I'm speaking with Paula, a diabetes specialist midwife. Whoop whoop. So, yeah, so you, so you support women navigating pregnancy with diabetes. So amazing. And you've worked with over 1,000 mums, helping them
Hmm.
reduce stress throughout their pregnancy. So I'm really excited about this conversation because we're just going to explore what's misunderstood about diabetes in pregnancy and how women can feel more calm and informed and in control, even when they're labeled high risk. So I'm super excited. So maybe do you want to just tell us a little bit about yourself and your journey?
Yeah, so I've been a background of nursing, and then I became a midwife. I always wanted to help people. I'm very attached to that. When my sister became pregnant, so it's kind of like I want to be a midwife.
Wow.
But with my background, I've always ended up more into the high risk label, because I wanted to get more holistic approach into that high risk. So I did fetal medicine unit, and then always my I don't know, I always been thrown towards diabetes, and yeah, I've been doing the role of diabetes specialist midwife for over 6 years now.
Wow. And do
Uh,
you have diabetes? Is that why?
no, 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 but I go. Um, it's a lot in the family around the problems with bulimia, anorexia. So it's always been kind of like looking for ways where we can be more healthy and look at the diet and having a better relationship with food. Yeah. So my best friend's type 1. So we've been since very little kind of join that kind of weirdness for people. Oh, what's that? What's that? Why are you doing this? So it becomes quite natural to us kind of
Wow. Okay.
navigating that. So yeah,
Amazing. So your best friend had type
yeah,
1 and now you're on type now you're a diabetes
yeah,
specialist.
yeah,
Amazing. Okay. So and now you work as a midwife, a diabetes
yeah,
midwife.
yeah.
Yeah.
I'm the lead midwife on the diabetes team in a
Oh,
local
right.
hospital.
And how is that? How is the work? How does it?
It's busy. It's busy. I mean, you can see the trend in the last 6 years. The numbers have increased. So I'm very pleased that pregnant women that live with diabetes come. That are scared of no. You if you have what you live with type 1, you can't have babies. Are you crazy? So that is not anymore. And
Yeah.
I see the
Yeah.
tendency of how we improving the care we're giving them. And I
Amazing.
think it's
And you mean
important.
the trend for type 1 is going up or the trend for
Yeah. No,
just
no, type ones, more type 1 moms are coming to us, so
oh
it's good.
wow.
Yeah,
Oh,
yeah.
wow.
In
Um,
the last 4 years or so, we can see more.
amazing. Yeah.
Hmm.
So tell me, what do you think the challenges they face are?
Well, I think the most challenge and people are ignoring is the mental load, that the pressure, the overthinking. Uh, you can't disconnect from that. You cannot go on holidays. You constantly thinking and measuring. So when they became pregnant, it's like they don't recognize their own body. The needs are different, so they need to kind of swap, and that takes a lot of change. Plus the pressure of, oh, this is dangerous. Oh, you need to have the readings in that target that is ridiculous tight for them compared to before. So is that change in your mind that why we need to do that? If they don't have the right support from the beginning, it could be really stressful. And in fact, we got that knowledge of the idea in research saying the distress on diabetes in pregnancy. And it's real. It's
Yeah,
absolutely real.
yeah,
So I think that's the main challenge, that we don't cover completely, or we don't help and support them on that mental load,
yeah,
the stressful that they have.
yeah.
And I think that's important, because at the end of the day, behind that type 1, still a human being, and it's a mom having a baby. It's
Nothing
like you,
big,
you
like yeah.
yeah, so I think that's why the role of a midwife within the team is so important, because we can advocate for them and pull back into the pregnancy joy, into what's going on and the connection, you
Mhm.
know, rather than only focus on the danger, 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 risk, risk, risk. So
Okay,
that for me is the main the
amazing.
main challenge, the
Yeah.
main challenge.
Amazing. Okay, so tell me what you do to help women to reduce this stress. What's your main
We get a connection from the beginning. I think in our team, the nurses are having a good relationship with these women. So I think from the moment they just have the positive on the stick, they just call. So it's a good thing. So we got people contacting us even before being booked. So week 4, week 5 of pregnancy. And that makes a huge difference because we can already start planning what the next step, getting a scan to reassure that the baby is viable, that they can see themselves, okay, I'm pregnant. Yes, let's do that.
yeah,
Arranging the appointment as soon as possible, getting the contact over the phone or by email, to know I'm gonna be looking after you.
yeah.
Um, so the plan sometimes is that I case load them, but I'm a bit divided on that because I want them to feel special, but not being special. I want them
Yeah.
to still be falling in the normality and the pathway like anyone else. I don't want them to feel like, oh, I'm in a special clinic
Right. And
all the
that's what
time. So
case loading means. Is that what case load?
yeah.
Yeah.
So case loading means when you just take care of them as a midwife, you just do the whole pregnancy with them. That is good
Mhm.
because you want the one-to-one care, but sometimes it doesn't work. If the lady lives quite far, coming to see me just for a blood pressure and a chat and listening to the baby, it might not work. It might be too much stress to come
Yeah.
far from that. So I'm not working every day of the week. So trying to fit those. So kind of like we give the opportunity to say, okay, we can caseload you, or if you want to go with your local team, absolutely fine. They can do that. And then we see you in your special appointments. It's just for them, I think, to know someone is there for them. And be my mantra on when I do my thing is I see you, I hear you, and I support you. I think most of these women are not seen, I'm not being heard of what they want to see. We
Yeah.
only see the label of
Yeah.
high
Or they
risk.
just see their blood sugar readings and then
Exactly.
you
Yeah,
don't.
and it's more than that.
Yeah.
Okay.
Okay, so that's really nice. And what about the birth? I mean, we've skipped
Oh,
a few months.
yeah. Oh my God. So for me, the problem I see is that they think just because you have type 1 diabetes, you don't own your body. You're not the concept that still a lot of healthcare professional use are allowed or not allowed. I think that is terrible. I mean, the women have the preference, and we will try to always meet that preference within the safety of mother and baby.
Right.
Okay, so yeah, the tendency is that because we don't know how the outcome will be, depending on how well the pregnancy is gone, you might have more chances to have the birth you want. But yeah, women can have a vaginal birth. Why
Right.
not?
Yeah.
But sometimes we interfere too early because we just say, oh, type 1, they need to be induced early because of the size of the baby.
Yeah.
Well, we need to discuss that in individualized care. And that is key. And that's why the midwives coming on the team to say, okay, hold on a minute, let's look at that. I'm very lucky because my team is amazing. I mean, the doctors that deal, the specialists on diabetes, they are incredible. I mean, they are not so focused on numbers. They kind of listening, and it's a joy to work as a team in that.
Wow. Okay, what's
So
the hospital? Because then we could,
in, in Royal
oh,
Surrey,
which one?
in Guildford.
Guildford. Gosh, that sounds
Yeah.
so
Hmm.
nice.
Yeah, I'm privileged. The team is amazing. I mean, yeah.
Because usually it's just an automatic C-section or induction. That's it.
No, I mean we always ask, but it's because we can predict what happen, and it's the diabetes itself can cause, the changes in the baby. So the mom only can focus on what can control. The rest is chance, and then we need to decide. But yeah, it's yeah, we have ladies that yeah they want to try. So we see its particular case, and we see the tendency is just because either the numbers are not well controlled because of the pregnancy cell is changing. The mother is fed up. They say at times, it's like I can't deal with that one more week. Like, you know. So, but we at least talk about that and see, okay, what are the options?
Oh my God.
Um, we very clear that the mother can use their own pump we try not to change into the things. And I always tell the moms, you know more, you teach me, you tell me. Okay, I only can see the patterns. I can help you to navigate that, but you know best. It's your body. You've been dealing with that. It's like your computer in there. So you tell me, and it's good that they can manage that. I mean, you got the whole type of patients as well. They are the people who still can get in the head that that's why we want the readings to be more tighter because of the benefit on the baby. And that takes a while for them to, well, I'm always been doing that. I feel okay. No, yeah, but you're pregnant now, so it takes work as well with some ladies to kind of connect with that. But in general, we know, and we have a pathway we put on the plan. So we see them at 36 weeks with a scan. We make a plan. What's the preference of the woman? We look at the birth plan, obviously within a reason of what is safe. And then we just make the plan that, yeah, this lady can use the pump. If it's going to end up having a C-section for whatever reason, then it could be that she choose that, or is a need to do that. Then we tell them where to put the pump, so it doesn't need to take it off for the surgery. But the team knows upstairs. We are in different levels on antenatal clinic where we see them, and then labor ward. But they know, if he comes with type 1, they use the pump and things like that. We're very good at connecting with them very beginning from the pregnancy, so they can use the closed loop now, the pump. But we give them the option. There are some moms that they still is something new they need to learn. They are already pregnant, so that change of, I don't know, it takes a while, so we support them if someone doesn't want to change into that, but we offer them, as soon as we know they're pregnant, we offer them to come and get the pump, because we know it's working. We know it will help them to have like a background. It detects better the hypos before it happened. But obviously the mom needs to feel comfortable with that and safe.
Yeah, I
And
can imagine it's like a whole nother world to learn the pump.
yeah,
And
it's, I
pregnancy on
mean,
top of that.
yeah, exactly. So it's too much going on. But yeah, no, we are quite flexible on that, but we always very clear. We know sugarcoat. I like always using the sugar stuff in everywhere. It's quite cynic, but
No, it's good.
this is me. I'm a clown sometimes. But yeah, you
Oh,
need to
great.
laugh at this thing.
What's your opinion on natural birth then for
I think it is possible. Yeah, I mean, you need to look at the whole picture and how this woman is doing. I mean, why not? And some of them can go naturally into delivery by 38 weeks because the baby says, well, I'm ready, I'm coming. So we can prevent that. So we support them, and we ensure that they bring everything they need, that they monitor during the labor. And we tell them, if you cannot manage, then we need to help you, because when you are in the zone, we need to see how to do it. So normally we tell the partner to, if they kind of know what to do, most of them, to say, okay, support her on that, the midwives in there, and they will tell us. We try, obviously, the diabetes team is not always there. We are 5 days a week, so Monday to Friday. So if something falls on the weekends, but we have a plan for that. And if they see, well, the pump is not working for this lady, then we need to think, okay, we need to go the old style, where we need to put a cannula and do the sliding scale. But I have to say that the pump works wonders. So it's very rare the cases we need to use that. So yeah, we believe on that. I mean, water birth and all that things, we need to check like anyone
home
else.
birth?
In my experience, we don't, because of the risk that things can happen, and it's more like the midwives doing and attending the birth. They are not very well equipped for that if something happens. So no, I know if they want to go privately, absolutely, but or hospital, I mean, we need to look at each particular cases. So it will be where they call out of the NICE guidelines. I don't think I have seen any lady type 1 who decides to go home
That
birth.
was me.
But Yeah, that was you. Perfect. Absolutely. Great. No, and I've seen cases, it depends, but you need to have a good team that support you. So I don't think the team that does it might will feel comfortable doing that. And I don't think, I mean, if your readings is being fantastic, the baby is in a nice size and good position, why not? I mean, you can deliver at home even without knowing like sometimes.
Mm.
And it's the what you use to help you the labor. What are the techniques you use? What do you make the labor to go more natural? So,
Yeah.
uh, how the environment is for you to help you to
Yeah,
to go into
exactly.
labor.
Yeah. Yeah, I feel
So
like
yeah.
once we're already very stressed, we're already on edge
Yeah, no,
all the
it's
time because,
well, I'm not surprised. You can disconnect. And I
yeah,
think when you're pregnant, it's extra pressure because you are in charge of
yeah,
another life.
yeah,
And
yeah.
they already, putting you that, but you can, the pressure, I mean, if you have too much, you can get calm if you go all that pressure. You need to get some support or have techniques to help you to
Yes,
manage that because
exactly.
you forget you're not a number and the numbers don't define you. You're still
Mhm.
a woman, you're still Abby, you know. You
Yeah,
you might be a mom, you might be a working mom, you might be, I don't know,
yeah,
single mom. You can have a mom that also have all the kids to look after. You're human behind that label.
yeah,
So there are things that we need to support
yeah.
on
It's
that.
so true. Wow, you are like a wonder midwife. It's
Yeah,
amazing.
it has to be like that. I mean, it's like I think we lost now because we want to keep safe and save lives and all that. We don't allow people to be human.
Yeah,
We don't allow them um, to make mistakes or to relax the way they should be. And the problem with pregnancy and diabetes is that you can't control all. It's a hormonal thing. It's biology. So I'm sorry, we're not looking at perfect numbers. We're looking at the patterns. And
mm,
that's what you need to focus as a type 1 women. And I tell them, it's like, do you know that you focus on the bad things when you have we can see on the continuous monitoring, it's like 85% in targets. It's like, hello, can you see that?
that's good. 85% is
It's very good.
right.
You know, you growing a baby and your hormones are all over the place. I mean, you're doing a great job,
Yeah, it's
you
amazing.
know.
Okay, so this is good. Okay, so tell me, what are women often told about diabetes and pregnancy that you don't agree with then?
Well, I don't agree with the fact that they can make a plan or a decision of how to birth, like we were talking about. I don't think that just because you have diabetes, you need to have a C-section straight away. It's
Mhm.
not the case. So that's one thing that it needs to change. I don't agree that because you have diabetes, you cannot use the pump. You just need to go and we use the sliding scale. No, because the woman knows better the body. It's been doing it all her life. So hello.
Exactly.
You're here to be with her, not to, you know. So let it be. Just support them. So I don't think that that will be a great support for her.
Right. So you would
It's
say no to sliding scale. Okay, this is good. And
yeah, it's just try first with the things that she's using,
yeah,
because and then if you need to intervene, then you help.
yeah.
But let her be first.
Okay, very nice. And
Mm.
okay, so tell me, what practical things do you offer to your patients that will help with the stress and to calm them down during the pregnancy? What do you tell them?
So first we make a good plan. So birth plan. I want them to know. What's going to happen on the day in different scenarios, because a woman won't, and woman won't be into labor if they don't know what's going on. They need to feel safe. They need to know what's happening. You don't want to go in when you are in labor and to try to decide what happened now, what kind of induction, if I have an induction, what happened if the induction fail, where I need to go, who is the person, is the person who is looking after me know anything about diabetes? you know Things like that. So that's the first thing, to be prepared. And you're not doing that the day of labor. You need to prepare it far in advance. Secondly is like preparing the different snacks and things that you like through labor, because it doesn't mean that when if you go natural labor or induction, doesn't mean that you can eat or anything. You still can do those things. But for more important is like, what tools will you use to feel calm, to allow the body to connect? And for me, I mean, I'm advocate of hypnobirthing. have a himbo baby. No one believed I was in labor. Almost have the baby in the car, but hey ho, or in the toilet. Um, but yeah, so I think it's important, and it's research. I was a senior research midwife for 5 years as well. So I'm a bit into anything that comes out on studies. I'm be checking, and it's been proved that relaxations, birth, like breathing, and all that help to control the sugars. It calm down. So the more calm you are, the lower the cortisol. So no high levels. Okay, so that will help anyone with diabetes will benefit from that. I will say that find like ways to connect to with the baby, not forgetting that you're a human being, you have a baby, visualizing how you would like this to happen, focus on the positive things, embedding that feeling. So when you go into labor, you will feel safer. Okay. And I think that's very, very important. Plan with your team what happened if plan A is not working, what happened with plan B and C. I think it's important to talk through those things before, not on the moment. Always feel strong enough to speak up, to ask questions. And if you disagree, ask, well, is that an emergency or can I wait?
Right.
Do you do that because you always do that, or is something that you haven't told me? Because maybe teach your partner, whoever is coming to see you, it needs to be involved. Otherwise, come alone. You don't want anyone to be, you need to look after. You want someone to look after you. You are the queen. You're gonna be the center of the story. So you need someone to advocate for you. You need to discuss with your partner, birth partner, whoever comes with you, what do you want, what is negotiable and what is not negotiable. Okay. And if you come at the 36 weeks, I always tell them you need to come with a list of things so we can discuss that. We only have 15 minutes, so you need to be spot on, boom, 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 boom. I mean, normally I have a chat with them in between, but when they come to see the doctors, I normally have that discussion with them and start from the beginning. What would you like to do? What will be the ideal birth that you want? What is the situation? Let's see if we can achieve that. So it's a way for me as well to motivate them to get there rather than focus on, as I say, on the negative things. But yeah, I think we forgot that we're human and that we connect and we go in life like rushing, and it's like when I go on holidays and I come back, it's like, where's everybody running? What is the fire? It's like we are constantly on that. And I'm like, calm down. Oh, I'm sorry, I'm late for my appointment. Okay, well, you're here now. Calm down. I'll see you. Don't worry. So it's important that they connect, that they talk to the baby, that they understand the body. They always been told, oh, type 1 is a big chance that the baby don't survive or that you can miscarriage early. So that's a lot of pressure. So I'm always tell them at each stage that we pass, it's like, okay, you pass the stage, you see, your body is receiving and is accepting this baby. So embrace that. You're growing a baby.
Amazing.
This is magical. There's some people that can't have babies. So hello,
Yeah, such a miracle. And so tell me, how are the doctors with you? Because you seem very, open to, them decide, the patients deciding how they want to birth, but how are the doctors and the obstetricians and,
I think that's fine. It's a constant, no battle, but yeah, it's a constant to remind them, and that's why it's so important to have midwives, the specialists in different areas, because you can bring that normality within the pregnancy. They are fine. I mean, as long as we can argument and demonstrate that what is safe. I mean, I'm lucky. I mean, I'm working so many hospitals in London, big ones, busy ones, and this one I have to say I'm quite pleased that we always pro women, and we try our best to fit the desires. But obviously we're a very busy hospital, and sometimes you can accommodate everything. But yeah, we try our best. I mean, even the normal rooms in labor ward, they have the fairy lights, and all the midwives likes to try as the best of their capacity to keep a nice environment. The doctor's trying to accommodate. Okay, let's negotiate. If you don't go into labor naturally by this day. We need to book at least something. We cannot keep waiting. And then it's kind of a negotiation in there to say, but you understand why. So it's never, I told you to, or you're not allowed to. It's always a conversation to say, okay, this is what worries us. And we open, we saw the scan and I say, okay, I know the scan might not be 100% accurate, but when you have type 1 diabetes, big babies are different to an non-diabetic women big baby. Okay, right. So we look at all these aspects to understand, and I think when you are open to that, fine. And if the women decides to go away from the guidelines, fine. I mean, the guidelines are no law. We just need to advise, as long as we have that discussion where the woman understand the risks and the pros and cons, is fine. Where I disagree, and I have this as well, for example, with gestational diabetes, when they don't explain clearly the medication for diabetes, the pros and cons of both. I'm always very like, you haven't explained that. Tell the woman all the pros and cons of that so she can make a decision. It's a full informed decision. Otherwise, you are guiding the way you want to go. And I'm very into that, not to, I'm very open and clear on the things. And if they ask me something I don't know, I say, sorry, I don't know, but I'll find out for you.
Amazing. This is great. And so tell me the difference between gestational and type 1, the women, the patients.
So we go, I mean, the majority of the patients I kind of look after are gestational diabetes. So it's the diabetes that happened during pregnancy or it's been detected for the first time while they're pregnant. So that means that some of them are labeled as gestational diabetes, but actually they might be pre-diabetes or type 2 diabetes, but we need to do that test after the baby. And that period, it will be considered as gestational diabetes. And those ones is only purely because of the hormones of the placenta that are causing the insulin resistance. There is a lot of sugar in the bloodstream, so that they either do a glucose tolerant test to check if they can pass the test or not, or they have to do a self-home monitoring of the blood pressure for the blood sugars for about a week or 10 days. And then once the baby's out, they stop monitoring, they stop any medication. So that's the difference. Type 1, you live with it.
Yeah.
Easy with you.
And what about the state of mind, like from someone with gestation? Because I feel like they wouldn't know anything, like how to measure or anything.
Exactly. So most of them is, and it's quite common, is the blame. So they feel guilty. They feel that they've done something wrong about that. So one of the things that I always tell my team, I'm very particular in the way I explain things. And I always tell them, ensure that the patient leaves the room feeling that it's not her fault. This is something that happened. And I always put the same example. It's like diabetes is always being, by society, is being blamed like, oh, you eat very badly, you done something wrong, you're not good. It's that blame on, oh, it's all the cookies I have. So now that it's going to be Easter, it's going to be a lot of people say, oh, that's because I eat all the Easters. Well, it's not good that everybody eats chocolate all the time, not for anyone in particular, but no, darling, it's not caused by the chocolate Easter you eat. It's just the hormones. And when they understand that, and I always say, but it's better to know that you got diabetes than when you don't know. So undiagnosed diabetes can cause more harm than when you have the diabetes, because at least once you know, the risks for the baby and the mom get reduced to almost like someone who's pregnant with no diabetes, because we're managing the problems when you don't manage it.
Yeah, that's such a lovely reframe. Like it's so nice. That's like so peaceful. Like, oh, it's good to know. It's actually good for the baby.
Yeah.
And what about the birth? Is it the same? You just assess one by one?
Yeah, we have to kind of do an individualized care. I mean, we got the nice guidelines and we follow that in our hospital and we go on policy, but we are quite flexible, seeing how the babies are doing and the mom are doing, if there's any risk on that, what's the past history for the mom, because some of them already have, I don't know, instrumental delivery and then decides like, oh, I don't want to do that. But we try, I mean, my team, the midwives, it's a good team. We always kind of like trying to calm down everything. Like we always tell them, okay, baby might be looking big, but actually look at you, you very tall. So we look at each person in particular. We look at the sugar levels, and I say, well, if you're not monitoring your sugars every day, then we can support you. When I first started, they didn't offer home birth for gestational diabetes, and I exposed them all the data and all the studies, and now we do it as long as the team is happy. And that's my way to say, you want a home birth? And people say, oh, I'm not going to be allowed now. It's like, we don't use that word allowed. If you want to, and it's all safe, we work towards that. And it's a lot of ladies that they do, because actually they probably healthier and looking after themselves more than someone who doesn't have diabetes. So.
This is perfect. Okay.
Mm,
So last question.
mm,
If your daughter or someone you knew had type 1
mm,
diabetes or even gestational
mm,
and was giving
mm,
birth tomorrow, I know it's a bit late for your daughter
mm.
to do that, but what would you want her to know?
That she's already an amazing mom, and the body's not broken. That is working. So
Right.
just embrace it and go for it.
That's so nice.
Just forget about the label. You are not defined by diabetes. You are Abby, you are Emma, you are Rose, whatever. You are
Mhm.
you. Just embrace it,
Yes.
and go with it. It's so empowering. Like, if I could have been giving birth every day all the time, I love it. I'm not too sure about afterwards looking after the kids and all that drama and tantrums, but giving birth could be an amazing experience.
Uh-huh.
So I will say, just go with it. Enjoy, trust your body, trust your instincts, and go
Yeah.
for it.
This, I guess, is the hardest part for, type 1
Mm,
with chronic illness. They
yeah.
don't trust their bodies. Like their body, like
Mm,
feel like our bodies have failed us already.
mm,
Do you notice that there's a difference? Like people who will just give
yeah.
themselves over to the. Hmm.
Yeah, but you still need to trust. It's like someone, I mean, I always compare with someone that have, I don't know, lupus, or they have any arthritis or anything, it's given to you. What do you learn from that? I mean, I always say, do you know how strong you are? What you're doing? You keep yourself alive. It's like, do you know how much you need to think? You're like a computer in your head. You never rest. It's like, give you a medal to yourself, give you a sticker to say, well done. It's like, you're not failing. You're doing amazing. It's
Yeah.
like you here, and on top of that, you brave, because you against well, the advice has been given, and I'm so pleased now that we go better ways to support you guys. Um, you pregnant, and you can have a natural birth
Hmm.
having type 1. It's just working towards every single day. And it's one day at a time. You don't need to be perfect. That's overrated. No one is perfect. You
No
are
one's perfect, but
special. You are limited edition. You are you. You special.
I love this. These words are so
Yeah.
nice. I wish every type 1 would experience a midwife like you. This is so lovely.
Yeah. It's because they
Um,
forgot. I mean, they think they are so institutionalized, it's so medicalized, that we forgot we're talking to humans. We are all
yes.
humans. And if you have a bad day, it's okay to feel bad. It's
Mm.
like, hello, you can, you don't need to be always happy. It's like, be happy, be happy. Well, if I don't want to be happy, what's the problem? It's my feelings. I got my rights to be
Really?
bad today. And I tell at work, it's like, I'm in a bad mood today. Don't ask me why. Maybe it's my period coming. I don't know. Who knows? But I'm gonna be moaning all day. Just let me be. And they let
Yeah.
me be.
As type
But
1s, we can't do that. We have to be on it all the time.
yeah, you own it, but you allowed yourself to, if one day you don't feel it, it's okay. Don't stay on that. I'm always say it's okay, acknowledge that feeling and then move on. Okay, don't stay and feed that feeling all the time.
Yeah.
But it's okay to acknowledge. You cannot bottle up all the feelings, because then at some point it will explode. So just acknowledge that it's there, and then focus on something. When you're pregnant, I always say, okay, you acknowledge that, take a deep breath. Okay, take another one. And then you regulate your nerve system. And that way you can see things in a different way, because otherwise you type 1 live in survival mode all the time, and that's not good. Okay. And that's why I think now with this closed loop, it gives you a bit of space because you know that something is kind of supporting you in the background. You still have to do your counts and the insulin before the meals or things like that. But at least you know that you don't need to overcorrect if a hypo, you know that's gonna come. I don't know. It's like you don't need to start pricking your finger all the time. You got the thing. So I think look at the positive things, how you can use that in your benefits, and try to enjoy and be human.
Yeah, amazing. So all type ones, they have access to these closed loops.
Yeah, is now the national guidelines in the UK says that as soon as you're pregnant, you get for a year the closed loop pump, and then you get the SCOM or the continuous monitoring. That is up to the women. We have a mix thing. Women that decide not to change because they're happy with the using, and it's that fear of trying something new when in the middle of that. But I think it's working. The thing is something new. I mean, the continuous monitoring is being for a while now, with 3 years that is being funding, so they all got it because it's safe, and they met the targets easier by using that. While the loop, we're still getting. Each hospital are doing their own kind of protocols because it's so new.
Wow.
But we know it saves time because it will be less hypos. It reduces the number of babies going to NNU.
Yeah, technology is amazing.
And
Okay,
one
so
thing
is there
important,
anything else that you would like to
I
share?
will say, I'm not so particular or bossy when it comes midwife. We talk about breastfeeding, but the only time that I really recommend to breastfeed or to find like a milk bank is if you type 1 diabetic.
Oh, right.
Is very important. Why? Because when the baby is born, if you give a bottle, it's more likely that when it digests it, because of the pancreas is slightly different for being born from a mom with type 1, it might have more chances to develop intolerance later on. So it's more important to have breastfeed, not only just for the connection mother and baby, but if it's any physical reason or think that the mom doesn't want to breastfeed, fine, but I will say you are entitled to have a milk bank. Don't know.
Yeah. Wonderful. You just dropped that one last minute. Okay, that's really important. So all the mums type ones should breastfeed if they can for the baby. Oh my gosh, that's amazing. Okay. Well, thank you so much, Paula.
My pleasure.
Have a lovely rest of the day. I really, really appreciate everything you
Thank you
said
for
and the
having me.
work that you do. And it's so great. I wish every type one would have a midwife like you. You need to clone yourself and go to every.
It's happening. It's happening. It's a lot of people
Thank you
anymore.
so much. Thank you.
Thank you.
I'll send you all the details. I'll send you the video afterwards. Okay.
Perfect. Thank you.
Thank you so much. Take care. Bye.